Knee and hip replacements that were previously thought to be only for older patients are now increasingly being seen in younger patients. This trend is due in part to the changing medical needs of the patient, as well as improvements being made to the procedures and the implants themselves. In this next segment, we'll talk with two patients about their hip and knee replacement and the life-changing impact that it's had. I'm here with Dr. Shofit, who is the medical director for the Joint Replacement Institute here at VIruta. Dr. Shofit, what problems in the knee and the hip usually lead to the need for a replacement?
Well, usually it's osteoarthritis, which is the loss of the cartilage cushion between the bones. So in a hip or a knee, we're supposed to have a cushion between the two so that we're not having that pain of the bones rubbing together. And when that cushion erodes or disappears, it can lead to painful arthritis.
Michael Balaban suffered from debilitating knee pain before undergoing surgery in both knees, one knee using a quad sparing technique. How would you describe the pain that you were experiencing before your knee replacements?
Very intense. What I wound up having was a lot of difficulty walking up and down steps, a lot of aches, pains, tough time sleeping, just because of the pain itself.
How much did that limit your life and your quality of life?
I had no quality of life until after I had the knees replaced, both of them. I'm not an old man, I'm a young man, and I waited until I was older than 50 to have the first knee surgery. That was really limiting what I could do physically. I was putting on weight, was not able to go to the gym, was not able to cut my own lawn. So yeah, it was very debilitating.
You do a procedure called the quad sparing procedure. Explain what that is and what that means to a patient undergoing a knee replacement surgery.
Sure. Traditionally, when we did a knee replacement, you have to get the kneecap out of the way. So what we would do is we would cut the quadriceps tendon and we'd flip the kneecap out of the way and put those nice knee replacement parts on it. And that did great. Patients did wonderfully. But after surgery, they're rehabbing the knee replacement and the cut in the quadriceps tendon that we performed. And they had a lot of struggles with pain because you have a cut tendon that you're also rehabbing at the same time. The idea with quadriceps sparing techniques is, can you put those same pieces in without having to cut the tendon? It makes the surgery technically more challenging. But if you can actually do that and put the knee replacement in, then when you're rehabbing the knee, you're not rehabbing a tendon that you cut and sewed back together.
What is the impact on a patient's ability to get up and be mobile after the surgery if you're not cutting the tendon?
Our patients are able to get up and walk on it as soon as the feeling returns to their legs after surgery, the same day.
Patients who previously may have been told they should wait to get the replacement because the joint itself will only last a certain amount of time now have the option to go a little bit earlier because that prosthetic will last longer.
Right. I'm glad you brought that up because that's the old wives' tale that we hear all the time. I shouldn't get it because so-and-so told me it's only going to last 10 years, okay, which is a complete fallacy. If it's going to only last 10 years, it probably wasn't put in very well.
How long did it take before you were able to walk after the quad sparing technique?
Without assistance, probably about a week. My experience with the quad sparing was I was able to move and had increased mobility that I didn't have before.
This is Jared Orth, and he recently underwent a hip replacement surgery. Jared, describe for us the pain that you were living with before your surgery.
Excruciating would be the word to describe it. Could barely even go about my daily routine without being in pain, whether it's getting up from a chair, getting out of bed, stepping into the shower. It was really a bad quality of life and just extreme pain from sunrise to sunset and everything in between.
How did you make the decision to undergo the hip replacement surgery?
It affected my life personally, even professionally, and I just was tired of the pain. At the time I was 37, so I felt I had a lot of life to live and I didn't want to delay the process any longer.
Jared's hip replacement also avoided cutting the tendon, which, like the knee, can be a very painful part of the recovery process.
There are a number of different minimally invasive procedures for the hip. A new approach, more novel, and certainly has been out there more recently, is to go from the very front of the hip. And you don't cut any of the tendons to get into the hip. So again, it's technically more challenging, but if you don't cut the tendon when you go in and do the surgery, then they're not rehabbing a repaired tendon after the surgery.
So how quickly were you up and walking around after the surgery?
Surgery was at 7, I was out at 9, and I was out of my bed and walking laps around the hallway around noon. So less than 3 hours.
Were you surprised by that you were actually up and walking?
I couldn't believe it, to tell you the truth. I was pleasantly surprised. I didn't really expect myself to be out that quick and, without any pain. The pain was immediately relieved, and you could tell that, things were going to be a lot better than they were the day before.
While other patients' experiences may be different than Jared's and Michael's, physical therapist Laura Say explains that increased mobility after surgery allows her to treat her patients more effectively. Now, Laura, for you as a physical therapist, how does it impact the therapy you're able to provide if they have mobility very quickly after the surgery?
Well, that makes the physical therapy quicker, and I can move them into more advanced activities. Plus the fact that they don't have pain and I'm not creating pain is huge.
In terms of a patient's ability to get out of the hospital and to get back into what feels like a more normal setting, how does that impact their recovery time?
That's huge, because not only are they back home resuming their normal activities as they're going to outpatient therapy. So to get them to come out as an outpatient is a big step.
There was physical therapy leading up to and following the procedure. Explain that for us and what that looked like for you.
When I had my first knee done, I really did not have any physical therapy prior. When I had the second one done, I was put on a physical therapy regime prior to the operation as opposed to just post-operation. I think that knee is to some extent stronger than the first knee, just because I had the advantage of the additional physical therapy.
Of strengthening the leg.
That's correct.
Prior to it being operated on.
Yes.
The more you move the knee after surgery, the less it's going to hurt. So right after surgery, even before they get their feeling back, when they have just the muscle control, we start them moving their knee. And it doesn't hurt as much when the feeling comes back because they're already moving it. And if it starts to hurt, they keep moving it more. And with the combination of pain pills and mobility, that's what allows them to get up and get moving and get home.
Life and Living has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Life and Living with Joanna Gagis has been provided by New Jersey Sharing Network, the Mental Health Association in New Jersey, Verizon Communications, Johnson & Johnson, Cone Resnick, United Airlines, and by the Russell Berry Foundation. Life and Living with Joanna Gagis has been produced in partnership with St. Joseph's Healthcare System.